I now invite Dr. Devendra Paul, my senior, who is an assistant professor medical oncology at Dayanand Medical College and Hospital, Ludhiana.
Hello, good afternoon, everybody. Am I audible, please?
Yes, you're audible. Your
I
screen,
can.
your screen is not yet visible, sir.
So, good afternoon, everybody. Thanks, organizer, for inviting me for this presentation. I'll be discussing about abstract presented in this ASCO, intestinal akkermansia, muciniphila, predicting overall survival in advanced non-small cell lung patients who are treated with anti-PD-1 antibodies. It's the results of the phase 2 study. Next. So the background of the study was that the gut microbiome, more specifically one of the most prevalent anaerobic bacteria, that is Akkermansia muciniphila, it has emerged as a potential hallmark for clinical benefit to the immune checkpoint inhibitors. So the goal of this study was to validate the prognostic significance of this bacteria in the advanced NSCLC patients who are amenable to treatment with immune checkpoint inhibitors. Next. So this multicentric prospective observation study was enrolled patients with advanced non-small cell CA lung patients who are amenable to single agent immune checkpoint inhibitors in first and second line. So the stool samples were collected at the study entry point. So the primary endpoint of this study was the investigator assessed objective response rate. So it was considered that a meaningful clinical difference would correlate to a 10% objective response rate increase in the Akkermansia positive group compared to the Akkermansia negative group. So at least 292 patients equally divided in each of this group would be required for a power of 80% and a two-sided alpha level of 5%. Next. So this study spanned over a period of 4 years from December 2015 to November 2019, and a total of 409 patients were screened, and out of these 311 patients were enrolled across the 12 academic centers in France and Canada. So the median age was 64 years, 32% were females, 77% had non-squamous histology, and the PD-L1 was more than equal to 1%, 70% of the patient, 70% of the total accessible samples. So this Akkermansia bacteria was detected in 51% patients and was absent in the 49% patients. And the baseline characteristics were well balanced between the two groups. Next. So when considering the Akkermansia positive versus Akkermansia negative groups, the primary endpoint, that is the objective response rate, was 27% in the Akkermansia positive versus 17% in the Akkermansia negative group, with a p-value of 0.04. So the rates of partial response, stable disease, and progressive disease were 62%, 50%, 46% in the Akkermansia positive group, as compared to 38%, 50%, and 54% in the Akkermansia negative group, again with a p-value of 0.04%. Moreover, 57% of patients were still alive after 12 months on the Akkermansia positive group versus 43% in the negative group. So the microbiome profiling further demonstrated that the Akkermansia positive group was associated with increased bacterial diversity and enrichment of other intestinal pathogens like Pneumococcus, Eubacterium, and others. Next. However, further considering the variations of relative abundance of Akkermansia within the Akkermansia positive group, they obtained a very large interval ranging from 0.002% up to 65%, with the 75th percentile falling at around 4.42%. The relative abundance of Akkermansia within the 0 to 4.42% range in stools at diagnosis was associated with increased objective response rates, overall survival in the multivariate analysis, independent of the PD-L1 expression and the ECOG performance status. This subgroup was associated with more inflamed tumors with upregulation of other receptors like the VCAM and the CD3. Conversely, patients with the overexpression of Akkermansia, that is those patients who had an expression of Akkermansia of more than 4.242%, they experienced a more progressive disease and a shorter overall survival. Antibiotic use, as said by the previous speaker, was associated with a shift in favor of gamma protobacteria and the further enrichment of Akkermansia. That is, more antibiotic use was in those patients who had Akkermansia of more than 4.42%, and this group was associated with a shorter overall survival. Next. So in conclusion, so this study validated the prognostic role of this bacteria, that is the Akkermansia, in the patient with non-small cell lung patients. Stratification based on the Akkermansia relative abundance represents a more accurate independent predictor than the binary modality. And this study provided the rationale to develop microbiome-based approach to study gut dysbiosis in routine clinical oncology care. Thank you.
Thank you, Devendra sir. Excellent talk. 2 back-to-back sessions on the role of antibiotics in immune checkpoint inhibitors. We now move on to the next topic.